So whenever people have these symptoms of colorectal cancer, the first question is, whom should I consult? The first thing is to get a proper diagnosis, and that is generally done by a physician who is a medical gastroenterologist who does a colonoscopy. A colonoscopy is a small diagnostic test where a scope, an endoscope, is put through the rectum and the entire insides of the large intestine are checked. If they find a tumor there, they will take a small biopsy, and this biopsy will be sent to confirm whether it is colorectal cancer. If it is colorectal cancer, then you need to see an oncologist. Most probably this would be a surgical oncologist. Now why? Because finally surgery forms a major part of the treatment of colorectal cancer. However, in today's times, it is not an individual doctor who decides treatment. There are multidisciplinary boards. For example, in our department, we have a medical oncologist, a surgical oncologist, a radiation oncologist, a medical gastroenterologist, all of them sitting together, a radiologist as well, and deciding which is the best treatment protocol for that patient. Because today, cancer treatment is not about one-upmanship. It is about a joint decision to benefit the patient completely and wholesomely. So now, what is the treatment of colorectal cancer? This has undergone a sea change. From the time when I was a student in Tata, about 25 years back, things have really changed and changed for the better. No longer we have long, huge incisions extending from top to bottom, but we now do colorectal surgery by minimal access or laparoscopy or robotic surgery. What difference has this made? The difference is that patients are recovering early, they are going home early. The complications, the chances of getting infections, the chances of a hernia are much more reduced after a minimal access surgery, and the results remain the same. Even if the incision is small, it still means that the surgery is as complete as doing it through an open surgery. Now, what do we expect when we undergo a colorectal surgery? Whether if at first the doctor will advise you a diet preparing you for surgery, which is high protein. One day prior, they will ask you to get admitted in the hospital, have a proper diet, have a liquids, have something to prepare your bowels, and then go in for the surgery for the next day. Typically, when there are no problems post-operatively, a patient might stay in the hospital for 3 to 4 days or even lesser. Post that, there will be a 1 or 2 visits to the hospital for dressing, by which your histopath report, which means the final analysis of whatever has been removed, comes, and that decides whether we require further treatment called chemotherapy or radiation. Overall, treatment protocols are standardized, and most hospitals which have a complete oncology department will take you through very smoothly when you go in for treatment for colorectal cancer. So friends, finally to sum it up all, what do we do as far as colorectal cancer is concerned? The first thing is, not all bleeding from the rectum is piles, and not all anemia is just related to lack of eating green veggies. So do not ignore these early symptoms. The body is talking to you. Listen to your body. Do an early diagnosis and get completely cured, because cancer diagnosed early is a curable disease.